Hello, I am Dr. K. Paul Stoller, and I recently posted a webinar on my protocol that can end just about any addiction, but there was too much to go over for one webinar. So I have made a series of videos to fill in the gaps. Addiction doesn't begin with drugs or alcohol. It begins with pain. For many people, addiction is not about chasing pleasure. It's about escaping something that never healed, an experience, a memory, a feeling the nervous system never learned how to shut off. Trauma, especially unresolved trauma, changes how the brain responds to stress, safety, and emotion. The nervous system stays on high alert. Sleep is disrupted. Anxiety rises. Emotional regulation becomes difficult. Substances, or compulsive behaviors, often become a form of self-medication, not to feel good, but to feel less. Less fear, less numbness, less pain. Alcohol, drugs, gambling, or compulsive behaviors temporarily calm the nervous system. They quiet the noise briefly, but relief is short-lived. Tolerance builds. The trauma remains. What looks like addiction is often a nervous system trapped in survival mode. Lasting recovery requires addressing the root cause, not just the symptom. The functional brain scans of addicts looks almost identical to the scans of those with a physical traumatic brain injury. That is consistent with the understanding that addictions are related, at least in part, to brain trauma. That is why once my addiction protocol helped end the symptom of this trauma, the addiction itself, I would have the now sober heal their brains utilizing hyperbaric oxygen therapy. My paper in the journal Pediatrics showed an alcohol-injured brain could be healed even 15 years post-exposure using hyperbaric oxygen. Healing trauma doesn't erase the past. It changes how mind and body responds to it. In my webinar, which can be found at kennethstellermd.com, I do discuss how trauma and addiction are connected and why real recovery must address both. Because when trauma heals, addiction will often loosen its grip.